Good morning. Today's Apollo 24/7's Health Hour is going to be interesting. We are going to talk about prevention and management of liver diseases. Joining us at 11 for a live session is Apollo Senior Gastroenterologist Dr. Naveen. You can join the live session and ask all the questions that you want to ask about liver health and gastroenterological issues. See you there, 11 a.m. sharp.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals, and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to 24/7's Health Hour. Health Hour is a show which is devised to give you power of information. You have questions and queries that you cannot enter a hospital and you want to talk to a doctor, then here's the show that you can raise a question and we clear your doubt. So today's show, we are going to talk about liver. As we are celebrating World Liver Day tomorrow, we are going to talk about liver diseases, and joining us shortly is Dr. Naveen Polavarapu, who is the HOD of Gastroenterology and Liver Transplant Services, Apollo Hospitals Jubilee Hills, in a while. So let's start the show. The show is going to have your questions and our answers. We are going to have a health quiz where I'm going to give you a question and you can win the prizes. Also, wait till the end where we're going to give away discount vouchers too. Let's start talking about vaccination. I hope everybody is trying to get their vaccination according to their turn. If you want to get vaccinated, there are 3 simple steps. Apollo Hospitals is almost has 62 hospital facilities which are giving vaccinations. And how do you get yourself registered to get vaccination from Apollo Hospitals? You have to download Apollo 24/7 app first, and then you can book vaccination slot. There is a very simple form you have to answer, and that's it. Apollo 24/7 will schedule your vaccination and notify you. So to make it more clearer, here's an AV on how to book your vaccination slot. Let's have a look at it. About the vaccination booking. It's a very, very simple procedure. Please go ahead and book your vaccination slot and get your vaccination done. So let's invite our expert gastroenterologist, Dr. Naveen Polavarapu, who is a senior gastroenterologist and transplant hepatologist at Apollo Hospitals Jubilee Hills, Hyderabad, who has more than 20 years of experience, who is awarded the best gastroenterologist by Times of India, who's ranked the 4th best gastroenterology unit nationally by The Week and the Times Health. He's conducted more than 300 liver transplants at Apollo Hospitals. He holds expertise in issues related to liver, pancreas, bile ducts, transplant hepatology, and complex gastrointestinal conditions and advanced endoscopic procedures. It's a pleasure to have Dr. Naveen Polavarapu on the show. Namaste and welcome to the show, Dr.
Namaste, everyone.
So welcome and congratulations to you and your team who have more than 300 liver transplants in your kitty. And on the world, tomorrow we're going to celebrate the World Liver Day, right, Doctor?
That's right. That's right. Absolutely. Yeah.
Understanding that liver is the most important organ for our well-being. How important is it to celebrate our World Liver Day too?
See, I think liver is a very important organ. It's the most complex organ that we have in our body. And in fact, the single largest organ in the body, and which does more than 600 to 700 different functions every day, including the food that you actually digest. So the protein, carbohydrates, fat metabolism, all of them actually go to the liver and they get metabolized. All the toxins that we actually, like similar to kidney, liver is also another filter which actually removes all the toxins from the body, producing important proteins which help in clotting the blood and also, forming cholesterol, synthesizing cholesterol. So a lot of things it does as a function. It's a big chemical factory. So I think it's a very important organ. And, we celebrate World Heart Day, World, Brain Day, Epilepsy Day and stuff. But I think it's important to understand that liver is a very important organ. And for that reason, the WHO, the World Health Organization, has made April 19th as a World Liver Day to make it aware, to make public aware of the liver, and it's important. And of course, it's not just one day we should celebrate World Liver Day. It's a 365 days a year that we should look after our liver. And to celebrate or mark that, they took April 19th as the World Liver Day.
Right. So understanding that liver silently does all the job, and
Absolutely.
liver disease is silent till it is advanced, is what you had told us last time when you were on the show.
That's right. That's right.
So how does one understand that there is a sign of liver struggling? Initial symptoms kuch milte hai? Are there any issues with how that I can identify in the initial days?
Yeah, so just let me just recap what I said last time. I think I'm going to say this again and again during the show, probably. I have no mistake in saying that liver is a silent killer. Until it gets at least 80 to 90% damage, you would not have any symptoms. So the beauty of liver is it regenerates. So any damage that happens to liver, it starts to regenerate by itself until at least it's about 80% damage. Once it reaches beyond 80%, it doesn't give any kind of warning or any kind of time for us to actually look. I'm kind of going to pack up and then I'll give you some time. It doesn't give that. Once it packs up, that's it. It's only going to be a downward trend from then on. All the symptoms that we see are after the liver gets damaged quite significantly. And that's why it's important that you check for liver function tests regularly. Now, coming to the symptoms, initially, people can have very, very non-specific symptoms, like, for example, tiredness, weakness, fatigue, losing muscle mass, for example. So these are the early symptoms, losing weight. So these are very non-specific, isn't it? So this could mean anything. Any disease can also present with similar way. So in the initial stages, you only have very, very non-specific symptoms. And until we reach a stage of the very advanced liver disease, you won't have normally any specific symptoms related to the liver. If you look at the symptoms which come in the advanced stage when the liver is quite badly damaged, you normally tend to see people with jaundice, swelling of the tummy, what we call ascites in medical terms, swelling of the legs, having blood vomit or passing, black stools, getting confused. Even, for example, people not sleeping in the night and sleeping during the day, a diurnal variation, so nocturnal sleeping pattern disturbance, or even not answering in a sharp way whenever we ask questions. So that also is an indicator that liver is not working well. So this in medical terms is called hepatic encephalopathy, which means all the toxins which liver would have got rid of in our body, the liver, because it's not working, all the toxins go to the brain and they cause the confusion. So these are all the symptoms which we see in late stages.
Advanced stage, right?
Yes, absolutely.
So as you were mentioning, liver functioning test is something that one should get done. How often and who should get this done?
Yeah. And I would recommend everybody should get, and well, similar to when you do an annual checkup, I think you should also incorporate a liver test every time, every day, every year that you actually do a liver function, any annual checkup. The reason I say that is quite often we see patients who come with liver abnormal enzymes, like the ALTs and the AST, which we look at the enzymes being elevated. They come to the clinic saying, look, I got an annual check and I saw these enzymes being elevated. What should I do about it? Because these are the patients which we can pick up early and we can actually rectify the problem.
Right.
Okay. So, and also people come, with hepatitis B and C, they test positive when they do annual checkups and they come. And let me tell you one thing about hepatitis B and C. Hepatitis B is much more common than the tuberculosis or the AIDS. In fact, hepatitis B is 5 times more common than HIV. Yet it doesn't get the recognition as HIV gets. In fact, hepatitis B is 100 times more potent to cause liver cancer compared to any other viruses or any other diseases. Yet it doesn't get recognized. I mean, it's baffling to see that.
And doctor, it is contagious as well?
Absolutely. Hepatitis B and C are very much contagious. In fact, it is estimated that 1 in 5 in the world have hepatitis B.
Oh.
Yeah, it is quite rampant and people don't realize it. And every year, at least 10 lakh people die because of hepatitis B related complications. Either it is cirrhosis or liver cancer, whatever the disease may be, but they die because of hepatitis B. And about 200 to 250 crore people throughout the world are infected with hepatitis B. So our Indian population is 120 crores, right? So we're looking at the population bigger than the Indian population, which is the second largest population in the world. Throughout the world, you have 200 and 250 crore people are infected with hepatitis B.
Oh God, that is a scary figure. So how about the vaccinations of hepatitis, doctor? Who should get done, and what are the vaccinations available?
Absolutely. Very good question. So for hepatitis B, for the last 15, 20 years, the children were born in last 15, 20 years, they get universal vaccination schedule. So they are generally protected in the last 15, 20 years. But everybody in the world should actually get themselves checked for hepatitis B and get vaccinated. It is mandatory for all the healthcare workers and people who are at risk of exposure to get hepatitis B vaccinations. But I think everybody in the world should get vaccinated. In fact, World Health Organization has made a promise, or they are working towards 2030, after 2030, to be hepatitis B and C free world. So that's, yeah. So every year there's a new program which happens on the World Hepatitis Day, and the theme is that by 2030 the world should be eradicated of hepatitis B and C. That will be only possible by all of us taking the responsibility, every individual, not just blaming the government. We should take the responsibility and get ourselves vaccinated.
Exactly.
Now, the other important thing I want to tell you, sorry to interrupt here, is for hepatitis B, there are medications which can control the virus, but there are no medications to eradicate the hepatitis B. And also, I'll take this opportunity to tell you how hepatitis B gets transmitted. It is transmitted by three main routes. One is through blood-to-blood contact or body fluid contact. So, for example, people having blood transfusions of infected hepatitis B can get hepatitis B. Sharing lasers, brushes, where there's a risk of exposure of blood-to-blood contact, you can get through that. Second common transmission route is to sexual transmission. And the third important is the vertical transmission. So from mother to baby. So the baby born to a infected mother can also get hepatitis B.
Right. So it's almost like HIV. All the three routes
Absolutely.
are literally like how HIV is.
Absolutely. And as I said, it's 5 times more common.
Yeah, and this is like, you know about HIV's transmission, and so much of information is available, but very less that we know about hepatitis B, which is more common.
Yes, absolutely. Absolutely.
Because this is the right occasion that you have made sure that we are talking about it. Thank you so much, doctor. So talking about lifestyle and liver issues, how can one take care of their lifestyle to have healthy liver?
Now, it's a very important question. The reason I say that, I'll come back to the treatment part a bit later. But if you actually, one thing which you want to take away from this show is the liver, to protect your liver, the most important thing is having a healthy lifestyle. We talked about hepatitis B and hepatitis C to a certain extent. So being the most common causes of liver problems. But I think the bigger elephant of the room is the fatty liver that we're seeing these days. Right. So the fastest rising cause of why liver is getting affected these days is because of fatty liver. And I'm sure a lot of you must have heard about fatty liver. You probably got scans for some reason, ultrasound scan, and then they mention as fatty liver. That's very, very common. The reason we're seeing that is people are getting more obese. We are seeing more of a Western type of a diet. And the more worrying part is the childhood obesity. So at least 20% of the children nowadays are obese. It's basically a disease where we're seeing people are getting much more fatter. And people with diabetes, blood pressure problems, cholesterol problems. So these are all the people who develop excess fat, particularly tummy fat, which gets deposited into the liver very quickly. And it does a similar damage, or much more worse than what alcohol does. You know that alcohol damages the liver. You know that viral hepatitis causes damage to liver. But fatty liver is much more serious and much more rampant. And we're going to see much more of these serious problems coming in the future. So I think, and unfortunately, there are no treatments available for fatty liver. The only tested, proven treatment is lifestyle changes. Having a healthy diet, and also having exercise every day in the life, in your daily practice or daily routine is very, very important.
Doctor, and you're giving this information, I just wanted to mention that Siddharth Malhotra, Prem Kumarji, aap sun rahe ho. Both of you have to listen to this because both of them have asked about fatty liver and management. So please go ahead, doctor.
Yeah. Okay. So although there is so much of research going on in terms of medications to look at how to control the fat and the consequences of the damage that happens to when the fatty liver, but I think the most important and the only tested proven treatment so far is your lifestyle changes. So we talk about different types of diets. We probably have questions about it, about what type of diet. If you Google, you will see a lot of diets like keto diet, intermittent fasting diet. There's something like ultra low fat diet. There's something called South Beach diet. These diets and all these are these are all can be dangerous, to be honest, and these are not right diets. The most important thing is having adequate amount of all balanced diet is very important.
Right.
We say that we should not be eating fat because we'll get fat. That's a misnomer. You need to have absolutely important elements of fat, protein, carbohydrates, vitamins and minerals. That is a balanced diet that you should have every day. And we have a microbiome or the intestine, bacteria and intestines, which also have a balance with what we eat. So we should not be making rapid changes to our diet. It's about eating healthily and having a discipline every day. That is what matters.
All right. So Siddharth Malhotra ji, आपका question answer कर दिए है. That will be the first question. He's having fatty liver and weight is 100 kilos. What would you advise?
See, the first most important thing is you need to have a mindset to change the lifestyle. Okay. So anything is possible as long as you decide what you want to do, isn't it? So, and as long as you lose at least 10% of your weight, okay, so the liver will start repairing by itself. Okay, so first aim for 10% weight. I know it is difficult. We see so many patients in our clinic saying, "Look, it's easy to say. You're sitting on the other side of the table, and then you keep bhashan dete ho." But how is it possible? Okay, so but I think the important thing to understand is don't make unrealistic goals to yourself. Keep a realistic goals. Okay, so don't expect that you'll be losing like 15 kilos within a month or 2 months. That's not going to happen. If you do that, you're going to regain all that weight, and whatever you're going to lose is unhealthy weight loss that you're going to have. So I think it's important to understand that you have a sustained response to it. So keep a realistic goal for you, for your practice. What is that I can aim for? But I think if you aim for at least 10% weight loss with the diet and also the exercise, then I think within 10% weight loss in 3 months, your liver will start repairing by itself. That's all you need to do, and keep that momentum going on, and then you keep yourself coming to the close to the healthy range. That's all is important. Everybody is different, so you have to work on what works for you, how it works for you. Nobody can give a fixed regime that you see somebody itna weight, itna exercise karo, itna hi karna. You are responsible for your health. You got to make sure that you take care of it in the right way.
Correct. And simultaneously adding to the similar question, Ripinjay Pandeyji says he has fatty liver and his triglycerides are high too. What's the link between liver health and triglycerides or cholesterol?
Very important question. So as I said earlier, people with diabetes, hypertension, high cholesterol, high triglycerides, particularly have truncal obesity. So tummy weight. The liver, the bad liver, bad fat, gets deposited into the liver much more quicker. Okay, and that becomes very resistant to get it off from the liver. So people who have high triglycerides, hypercholesterolemia, they're much higher risk of developing fatty liver and then progression, which is what we call in medical terms metabolic syndrome. So these are the people who we call metabolic syndrome. So it's important that you control the triglycerides, keep it under control. Of course, there are medications which can effectively control that, but also looking at your diet and exercise are also important along with the medications.
All right. So moving on, Sean David's question is, most of the time my belly is hard and a little bulging. Please advise.
Well, so tummy bulging could be for a number of reasons. One is it could be excess fat in the tummy, as I said, truncal obesity, as we discussed, or it could be that there's excess fluid in the tummy which should not be there, or it could be even bowel distension. If you don't have the right bacteria, the bowel, the intestines can get distended. That can also present as a distension. Certainly you need to, so which one is what we need to assess, which means we have to see you, examine you, and probably do a scan to understand what is going on. And then we can advise you what is the right treatment, because the presentation is different and every treatment will be different. So I think you need to get yourself checked first to understand what is the reason for your distension, and then take it from there.
All right. Ramaraj Venkata Subramaniam Garu is asking a very important question. Also explain alcoholism and its effect on liver.
Yeah, so let me take this opportunity to tell you that alcohol intake has significantly gone up, particularly during the COVID times.
Ah.
We're seeing, yes, absolutely. People are just sitting at home drinking, and once it becomes a habit, they're just not able to come out of it. And we're seeing so many patients. I was surprised, to be honest, because we thought probably people won't have money to buy alcohol and drink significantly,
We took
but
it from
that's
last lockdown, and once we opened the wine shops, we understood that people have
absolutely,
not money to buy.
absolutely, absolutely, absolutely. So I think what we're seeing is significant intake of alcohol, and particularly during this COVID times has gone up. And as I said, we know that alcohol is something which causes liver damage. Everybody knows. But the problem with alcohol is it causes significant damage to an extent where it reaches a cirrhosis very quickly. And once it reaches a stage of cirrhosis, so cirrhosis is nothing but a medical term where there's an irreversible damage that happens to the liver. So whenever, see, whatever the culprit may be, whether it is a viral hepatitis or alcohol or fatty liver, it starts with inflammation in the liver. The inflammation, when happens continuously 24 hours a day, 365 days a year, that inflammation leads to scarring. That scarring progresses towards the cirrhosis or irreversible damage. So until the stage of scarring, we can reverse the situation as long as you remove the culprits. For example, if it's alcohol, you stop the alcohol, liver will recover. If it's viral hepatitis, you control the virus, it will recover. But once it reaches a stage of cirrhosis or permanent damage or reversible damage, it won't recover. So from then on, it's going to be a downward trend. Okay, so I think important to stop the alcohol. I know it is not easy. Absolutely, we totally agree with that. But again, as I said, it has to be realistic. Okay, I'm not expecting that you should stop just like that. Gradually cut it down over a week or so, and then understand the consequences. First, most important thing is, why am I drinking alcohol? Is it because of depression, or is it because of a habit, or is it because of friends? There's so many people come with different type of reasons. So you need to understand yourself, why am I drinking alcohol? And if it is a pleasure, then you have to start understanding, is it something which I want to do? I actually, I'm sorry to say this, but when we see a lot of patients with similar kind of situations in our clinic, I actually asked some of them, do you want me to take you through to the ICUs and the wards where people are admitted with alcohol-related problems? You can see once, then you'll understand. You're going to see yourself in maybe another 6 months to a year if you continue to drink the same way, because they should understand what's the reality what's the other side of the coin too. I'm not saying that you should stop drinking alcohol completely, but you have to drink in a religious way, in the prescribed way. If you do drink, if you can't stop it, then you should not be drinking. Okay. Alcohol.
All right. So that was an interesting observation from your end, that we are in a pandemic and battling yet another pandemic because of our habits.
And another bigger pandemic is the fatty liver.
Is fatty liver? Yes.
Yes.
So while talking about fatty liver, there are a lot of questions which are still pending about fatty liver. I'll take them later. But somebody is asking, there are 2 or 3 people asking about gas and gastric troubles. Ramesh Shah पूछते हैं कि all the other tests are normal, but I take Pentium 40, but there's nothing that it doesn't help him. Anand Upadhyay, any medicine for gas? And a lot of them I saw. So you can address gas and gastric issues first.
See, this is one of the common symptoms or common presentations that we see in our clinic on a day-to-day basis. So gas or the gastritis, it's a very common and it's a very broader kind of a symptom or presentation that people have. It could mean anything, to be honest. It could be that excess acidity which is happening, or it could be that there's excessive bloating in the tummy because of very bad. See, in our intestine, we have a good bacteria and bad bacteria. They live in a harmony, in a balance. Whenever the balance is lost, you have more of a bad bacteria, you can get bloating symptoms. You can have excess gas production, belching, flatus, or passing gas from the bottom. So these are all the things that we commonly see. The important thing to understand from this point of view is, why is this happening? So, the important question we always have is why, and how, isn't it? So if it is to do with our lifestyle again, okay, if we're not eating food at regular times, having a long gaps, not eating the right type of food, are the common reasons why these things happen. So the reason why I keep stressing on it is, it's not the treatment or the medications, it's the changes that happens. Why is it happening? So that you reverse the process. That's
Right.
the treatment essentially, isn't it? So you have to work on those things to try and minimize your symptoms. If you're still having symptoms despite taking the medications, then we need to try understand what else is going on. So you certainly need to see a gastroenterologist so that we can evaluate. There are different reasons why this can happen. So we will have to evaluate one by one and then give a specific treatment for you.
All right. Doctor, here's Mr. Senapati's question. Is weight loss connected with liver issues? How to begin investigation about the cause of weight loss? Weight came down from 70 kilos to 59 kilos in 9 years for a 73-year-old male who's a patient of CAD and RLS.
Right, right. Okay. So weight loss could be for a number of reasons. We certainly need to be investigated. There are, as simple as thyroid can also cause, excess thyroid can cause weight loss. To an extent, psychological issues can also cause weight loss. But more than that, we need to look for other reasons. Are there any organic problems in the, not necessarily in the liver, not necessarily in the stomach? We need to investigate why you're having weight loss. So you certainly need to see a gastroenterologist so we can evaluate all these things in detail. Certainly, if you are persistently losing weight, then you definitely need to be investigated. So I would certainly recommend you to see a gastroenterologist as soon as possible.
Okay. Doctor, here's somebody by the name Train Lover. I have NASH with F4 fibrosis from 2 years. I reduced 6 kilos of weight. Anything else that he can do?
Yeah, that's good that you lost weight. And if the NASH is a reason for your fibrosis, then that's fine. I think the treatment is right. You have lost weight, but also making sure that you sustain it and keep your exercise going on as well if you continue to do that. And I would suggest getting another scan again to see whether the fibrosis or the scarring has resolved or not, how is it reduced, and also looking at basic liver function tests. So I think you should get another consult with the liver specialist so that we can reassess whether your risks have come down, and so that we can advise more if there's still persistent problem. See, fibrosis could be, often we see it, we think it's only NASH related, but sometimes there'll be hidden problems like viral hepatitis. They can also cause fibrosis. So we need to assess, make sure that there are no other culprits. So essentially, we need to remove all the culprits and reverse the process. That's what we need to look at.
So NASH is also something that one needs to understand, which is coming up really very fast. Would you
Absolutely.
want to explain what NASH is to our audience, doctor?
Yeah, so NASH is an abbreviation, which is a medical term, which means non-alcoholic steatohepatitis. Okay, so just for the audience, anywhere that you see itis means inflammation. Okay, so hepatitis means liver inflammation. Okay, so and steato means fat. Okay, and we're talking about non-alcoholic. So alcohol can also cause fat. So we're talking about a terminology which is a non-alcoholic. So it is not alcohol, it is a fat which is causing inflammation to the liver. That is what we call a NASH, or non-alcoholic fat steatohepatitis. Now, so whenever the fat gets deposited, we call it as NAFLD, which is non-alcoholic fatty liver disease, NAFLD, NAFLD. When NAFLD progresses to cause inflammation, we call it as a NASH. As I said, itis means inflammation. So NASH is nothing but a progression of the fatty liver causing inflammation to the liver. Now, NASH progresses towards cirrhosis. When this inflammation, as I said, continues to happen over a number of years, that progresses to forming fibrosis, scarring, and that leads to cirrhosis. So that's a natural progression of what happens when somebody has fatty liver. The progresses towards NAFLD to NASH-related cirrhosis.
Oh, that is the progression.
Yes.
Because we are hearing too many cases of
absolutely
NASH these days.
That's nothing but fatty liver, which is progressing.
Ah, that's interesting. All right, Dr. Garu, Raja Ram Mohan ji पूछते हैं, Kamire Raja Ram Mohan Kamireddy पूछते हैं, my total bilirubin is 1.8 and direct bilirubin is 0.4 mg per dl. Protein 7.2. Is there any medication required, or through diet can I manage?
Yeah, so first we need to understand why your bilirubin is slightly elevated and how long it's been elevated. We need to understand the reasons why the bilirubin is elevated. Okay, so based on that, we can suggest whether treatment is needed or you don't need any treatment. There are certain conditions where liver in general is lazy to work. As I said, liver is a big chemical factory. A lot of metabolisms happen. So whenever that metabolism is slowed down because of the genetic issues, then also you can have raised bilirubin. That doesn't mean that liver is abnormal or we need to worry about it. Okay, so that nothing to worry about that part, but we need to understand that what is the reason why you're having jaundice. just to give a small example, if you have excess breakage of your red cells, you have red cells, white cells, and platelets in our blood, isn't it? So whenever there's an excess breakage of the red cells, this can also cause jaundice.
Okay.
That also can cause raised bilirubin.
Oh.
Okay. Yeah. So if there's a blockage to the bile pipe, that can also cause jaundice.
Okay.
Yeah. So gallstones can cause jaundice. Pancreatitis or pancreas problems can cause jaundice. So we need to understand what is the reason why people are getting jaundice. There are 150 reasons why people can get jaundice. So we need to understand that, make sure that we're not missing anything sinister or serious, and understand the process so we can give you right advice.
Okay. So as we are talking about this, a lot of people are asking, two Telugu people sitting here, why are you not talking in Telugu? Andarki namaskaram andi. Telugulo iddaram maatladagalugutam, but ee కార్యక్రమాన్ని దేశవ్యాప్తంగా చాలా మంది చూస్తున్నారు కాబట్టి, in case somebody requires a specific answer that you don't understand the language, please do mention that specifically. Dr. Garu will answer that in Telugu. Okay kada Dr. Garu?
Absolutely andi, no problem andi. Meer ఏ తెలుగులో అడిగినా no problem, నేను తెలుగు వాళ్ళం మేము కూడా.
Okay, done. But to reach out to the larger audience, we will continue in English. In case somebody requires it in specific language, please mention and we shall take it up. All right. Dr. Garu, here's another question. How to prevent liver and kidney related issues if you are taking diabetes medications for more than 30 years?
A very important question. So all these organs, liver, kidney, heart, lungs, they're all connected in a serial way. So when one organ gets affected, automatically other organs will also get indirectly affected. Yeah. If the damage becomes significant, then the damage to other organs becomes much more significant, and what we call multi-organ failure. And once you have more organ failure, then that means risk becomes significantly higher. Okay. The reason I say that is people with kidney disease and liver disease need to understand why both of them are affected. The common reason is, for example, diabetes. So people with diabetes can get affected, kidneys get affected with them. As we know, diabetic nephropathy, diabetes. So that diabetes can also cause damage to the liver, and that can cause the NASH and then NASH-related cirrhosis. So we need to understand what is the reason why the organs are getting affected, and so that we can give a specific treatment. So there are other conditions like autoimmune conditions where our own soldiers of the body, which should protect against any infections or outside things, they sense that the liver and the kidney are outside organs and they start damaging them. And once they start damaging that's where the inflammation happens. So we need to understand the process, why this is happening, so that we can reverse the process, which is the treatment.
Okay. Anil Kumar Sharma ji पूछते हैं, when stone is in gallbladder, is it must to remove the gallbladder?
Okay, so gallbladder stones are very common. Okay, so if I pick up about 100 people from the road and I do a scan for them, probably about 15-20 of them will have gallstones.
Oh.
Yeah, it is quite common, especially in people who are fat and in their 40s and 50s. They have increased risk of developing stones in the gallbladder, but doesn't mean that everybody needs a surgery or removal of the gallbladder. Okay, so it's only people who have symptomatic who have problems with gallbladder, or if their liver enzymes are abnormal, or if there is inflammation which we picked up on the scan that gallbladder is getting affected. Those are the reasons why we say we should remove the gallbladder. But in general, if you have stones, but certainly get yourself checked so that we can look at it all to assess all these things by what I said, and then can give you the right treatment for you.
Okay, Nikesh Jain's question I felt is important. He has a 5-year-old son who is suffering from biliary atresia.
Biliary atresia.
All right, so that's it, and he's prescribed by the doctors sorbilin syrup, heparmez, and that is from the age of 3 years. So want to ask, is this dose fine? Does it have to be increased?
Now, it's a biliary atresia is a complex condition, to be honest. Let me just tell you a little bit more about, for the other audience, what biliary atresia means. So you have the liver, which synthesizes all the bile juices, and it gets drained through the bile pipe into the small intestine. So the function of the intestine is to produce the bile, and when we eat food, all the bile juices come through this bile pipe into the intestine to help in digesting the food. Okay, whenever there is no formation of this bile pipe, so there's no collecting system. Okay, so that is what we call atresia. So it's a biliary atresia, means he doesn't have the bile pipes which are which take all the bile from the liver. So that's what the problem is. So you don't have an output of the bile. Okay, so it is actually a medical emergency, and a lot of kids will have to go for an operation immediately. So this means that the kid, the newborn, is born without having that bile pipes. Okay, so that's a medical emergency. So we'll most of the kids, they go for a surgery immediately as soon as they're born. Okay, so and sometimes with that surgery doesn't work, we'll have to go for liver transplant. In our Apollo hospital, we've done transplants for these biliary atresia children, quite a few of them with successful outcomes, because they don't have a collecting system. So we had to create a collecting system for them. So if you have biliary atresia, I'm sure you are in consult with a liver specialist. So we need to understand how your liver is getting affected, and is the flow happening properly. And if the flow is not happening properly, then we'll have to look at the options of surgical options, how to correct the flow issues. So we need to look at in detail whether this medication is sufficient or not. Is difficult to tell without seeing the case in detail.
Yes, on this show, I don't think this is the right platform to discuss much deeper. Yeah, but doctor can be consulted on Apollo 247 all the time. He's available, and his team is also available on Apollo 247. Okay. Mr. Chatterjee's question is, despite daily exercise and restraint on excessive food, I suffer from frequent constipation and frequent indigestion. Also facing moderate piles from almost 5 years. It occurs mostly from the summer seasons, March to June. Blood secretes from the anus line. It's itching and painful. So how does
Yeah. So as I say, I mean, you're not the first person, and it's very common, particularly to see in the summertime, because we get dehydrated very quickly. And so that, I mean, the most common reason why people get this constipation, piles, and all these things is because of not having adequate water and not having adequate fiber in the diet. So I think it's important to be more conscious about it, and particularly during summertime, drink plenty of water, keep yourself well hydrated, and also having plenty of fiber in the diet. Despite that, if it's still happening, then we'll have to start understanding why this is happening, why you're getting constipated. See, intestine is a muscular tube. So one area should contract, the forward area should relax, and this will contract so that it goes in the forward direction. Whenever that transit is not happening properly, what we call a slow transit, that can also lead to constipation. And there are certain conditions which can cause a slow transit constipation. So we need to evaluate for that. And even things like hypothyroidism or thyroid levels being low can also cause constipation. So we need to try to understand, are there any medical reasons why you're getting constipated? Are there any lifestyle changes that we need to do to rectify your constipation? Are there any medication that you need? So we need to evaluate all these things in a bit more detail. Simply, giving medications is not the solution. We need to understand why this is happening.
Okay. So somebody else, I missed the name while listening to you. Somebody else was asking about indigestion. Unka frequent indigestion issue hai. So how does one help?
Yeah, again, we keep coming back to the same thing. Indigestion generally happens when we insult the body, when we insult our stomach, to be honest. So eating food at regular times, small frequent meals is probably the right thing to do. And try to understand what are the foods that is actually helping me, what are the things which are not helping me. Of course, sitting in the remit of the balanced diet, you need to work on that. And as I said, most important thing is eating small frequent meals is generally what will help people. But if you're still having symptoms, then we need to check to make sure there are no ulcers, there's no infection. There are particular bacteria called H. pylori, Helicobacter pylori, which sits in the stomach and cause excess acid. Unless you remove that infection, you will produce more acid in the stomach. So we need to understand why this is happening. But the first most important, I think the starting point for you is the lifestyle changes, eating small, frequent meals, not having a heavy meal and then going to bed. Okay, so you should have at least 2 to 3 hours gap between your dinner and your bedtime, to be honest. So I think working on those things and then take it from there.
Okay, so this is the right time to answer Mr. Nibu Augustine's question. He was asking about fasting. Is fasting or not eating anything in a day, giving rest, good enough for liver?
See, there are different ways of dealing with it. And if you look at traditional ways, particularly Indian population, we do fasting for pujas and stuff. Is it good or bad? You can argue both ways. There are no research or randomized controlled trials which will tell us this is a good way of, this is a bad way of doing it. Okay, but having said that, having adequate rest to your intestines, to your body is also important. But eating food, the sensible food, the adequate balanced diet is more important. I'm not saying fasting is bad, but what I'm trying to say is making sure that you eat balanced diet whenever you're eating, and eating small frequent meals is what generally would be more helpful. If you are a guy who's been fasting for a number of years and you are used to it, fasting, and you're quite comfortable with it, and your body as a machine is working fine, then I don't see any reason why you should change.
Okay. Okay.
But making sure that you take balanced diet,
Yes.
that's more important.
Yes, and to continue to all those people who have been asking about fatty liver and diet, there are a lot of questions which are related to fatty liver and diet. And somebody was asking, simple carbohydrate food, will that affect fatty liver? Will eating fatty foods affect fatty liver? And also one more question was, will Live 52 help me in dealing with fatty liver?
Okay, so the body, the way it works is, the important energy source for our body is the glucose. Okay, so glucose is what we get from the carbohydrates. But when you have an excess amount of glucose, whether that comes from the carbohydrates or the fat, it gets stored into fat. So excess amount of carbohydrate that you take, you only need that amount of glucose. Rest of the glucose gets converted into what we call a glycogen, or it gets converted into fat. Okay, so excess amount of carbohydrate will also get converted into fat if you're taking excess amount. Okay, so and also when you're actually fasting, your fat stores will get used up, because the fat will start producing glucose.
Okay.
Okay, it gets converted to glucose. So because we need glucose for our body to work. So anything in excess, that's what I keep saying. You know, people these days, what they're looking at is high protein, low carbohydrate diet, low fat diet. You know, whether to build muscle or to do whatever they want to do, but anything in excess, you know, is not good. You should have adequate amount of fat. Fat is, or oils are very important, particularly the monounsaturated fatty acids and polyunsaturated fatty acids are very important for our body to work. These are very important oils which help for the brain to function and rest of the body to function well, to be honest. So adequate amount of fat, proteins, and carbohydrates. You should have a balanced diet. Now, people ask, what is a balanced diet? So having all of them in adequate quantities is nothing but a balanced diet. So don't restrict yourself by eating a very, very small proportion of rice or chapatis, and then eating more of proteins or chicken or whatever, high protein diet. I think, you should have a balanced diet of everything. That's the most important thing. And also doing exercise. That's very important.
Right. Vishnath Agarwalji, you mentioned that due to poor connectivity, not able to follow this important discussion. Just to make a note, please make a note that this show will be available after the live session too. You can catch it up on Apollo 247's YouTube channel. Okay. Dr. Garu, a lot of people are asking, pain in the stomach, pain on one side. So how do we address the pain?
Okay, so if you're having pain, that could be a number of reasons. So we need to evaluate it. It's difficult to tell without getting through the details of the pain. Where is the pain exactly, and what are the trigger factors? What are the relieving factors? What are the associated factors?
Side pain, and somebody else was also mentioning continuous pain. Yeah.
So if, for example, it's happening in the right side of the tummy, it could be liver related, it could be gallbladder related, it could be even pancreas, stomach related. So there are so many organs which are there. So we need to understand the nature of the pain and how long it's been there, and also what are the associated factors with it. And we probably will have to examine you. It's difficult to tell just by telling the pain and one side, because these are all, every disease or say if it is a gallbladder related problem, the treatment is different. If it's stomach related problem, it's ulcer related, treatment is different. So we need to evaluate what is the reason for the pain so that we can give the right treatment, specific treatment for you.
All right. Dr. DJ397 is asking, I have ulcers in the mouth and throat due to gas and acidity. Is this common?
Generally not common, but having said that, both are interlinked to an extent because of the diet. If you're not having the adequate or the healthy diet, you can be malnourished from the vitamin deficiencies point of view. That can cause the ulcers in your mouth, and you're probably not having adequate amount of right diet that is also causing the ulcer. So it could be the primary being the same problem of not having the right type of diet, causing both different problems, but not the acid in the stomach will not cause ulcers in your mouth. It won't come up to cause ulcers, but it could be because of the diet which is causing both the problems. I hope it makes sense.
Yeah, it does. Doctor, there was something else that I missed earlier. Somebody was asking me that they are not able to absorb B12. The stomach is not able to absorb. B12. So what is the way?
Yeah, so very important question because vitamin B12, there are factors in the stomach which help in in absorbing the vitamin B12. Vitamin B12 effectively gets absorbed into the small intestine, last part of the small intestine. But for it to get absorbed, there are certain factors called intrinsic factors which are synthesized or which are formed in the stomach cells. So whenever you have deficiency of those particular cells to produce this intrinsic factor, the vitamin B12 doesn't get absorbed in the intestine. So you need to we need to evaluate why you having absenteeism of intestine of the intrinsic factors. So you certainly need to be evaluated for that point of view. We may even have to take some blood tests and also sometimes biopsy or sample from the stomach to understand what type of cells are you lacking. So you certainly need to see a gastroenterologist for that.
Okay. Okay. So next question is Krish. What is the percentage of chance to get a liver cancer for a person if his father and stepbrother were already diagnosed with the same?
Yeah, so very important question. Family history is very relevant, particularly if the cancer is running in the family and the people with cancer got affected with it before 45, 50 years of their age. So that means they probably are carrying an abnormal gene and they need to be regularly evaluated. And often, along with the genetic reasons, as I said earlier, hepatitis B runs in the families also. So it could be that both the brother and the father may have been carrying the hepatitis B virus, which resulted in the cancer without them knowing about it. Only they unfortunately got to know about when they had liver cancer. So, so this is very important because if you do have hepatitis B, if you control the virus now, your chances of getting liver cancer or liver cirrhosis are significantly reduced, almost to the extent of 100%. Okay, so that is the reason why I keep saying hepatitis B or hepatitis C or any of these culprits, we need to understand the culprits and minimize it. That's the reason why we need to get ourselves checked regularly with liver tests and the virus tests so that we can minimize the risk. So if it is hepatitis B related that his parents or father and brother had it, so he could rectify or he could stop it, isn't it? If he gets the hepatitis B checked and then get himself treated for hepatitis B, he would not get the liver cancer.
Okay. So yeah, next question is Dushyant Kumar's question. SGOT to SGPT ratio is more than 10. 10-1. Please advise.
Yeah, so SGOT, SGPT are enzymes, liver enzymes, which you look at to understand the pattern of the liver damage that is happening. Generally, if the SGOT is higher than SGPT, that means generally we see that in people who take alcohol, or there is insult to the liver because of the alcohol-related associated conditions. So we need to understand what is the reason. Of course, more than 10 is significantly higher. So we need to definitely assess what are the other damages that is happening to the liver. What is the albumin levels? What are the protein levels? What is the bilirubin level? How is the liver looking structurally? And what are the vessels which run into the liver? How are they looking like? What is the pressure? So we need to understand all those things before we can give a clear advice about why is it elevated and what we need to do. So, but as I said, the liver is such a beautiful organ. As long as you remove the culprits, it recovers. So you need to understand that and reverse the process.
So it's a wonderful line again from you. Understand that you are making your liver suffer, the organ that can regenerate itself. Give
Absolutely.
it time to heal.
Absolutely. Absolutely.
Yeah. Somebody was asking that I missed the question. Sorry, just hold on for a sec, doctor. Okay. What amount of liquor is okay for liver to digest? That is not the question I wanted to ask, but as I was scrolling, I forgot.
No, I think it's an important question. You know, we get asked often in our clinic. So yeah, see, we also hear about people saying drinking one glass of wine is good for health. So what do you say, doctor? Why no? So we get all this conflicting information. You say that you should not drink alcohol, yet some people say that you should drink wine. See, frankly speaking, this is a habit which we all, over a number of generations and centuries, we developed it. And alcohol, by and large, it does cause damage to the liver. There's no question about it. Okay, but the point is, you should see all this alcohol that you take gets metabolized in the liver itself. So because liver is such a good organ, it metabolizes, okay? But when you're actually giving more kind of insult to the liver, it won't metabolize, it causes more damage to the liver. Okay, so that is the reason why. So if you don't want to insult your liver, then don't drink alcohol. Absolutely zero alcohol is what we should say. But when the liver is working, if you still have to drink alcohol, drink in the moderation. That's very, very important. You should not be over abusing your body, over abusing your liver. Okay, but what we see generally is people, when you ask them to stop alcohol, they think that they can stop it, but a lot of people can't stop it.
Yeah.
They don't have the willpower to actually reduce and take in the limited quantities that was recommended. They can't do that. So that's the reason why we say you stop the alcohol completely.
Okay.
As long as they have willpower, they can do it.
Done. So, doctor, a lot of people were asking how often one should get an LFT done, especially if you are detected with fatty liver and if it is stage 1 or progression. How often does one have to test?
Yeah, very important question. So I think as part of the annual check or regular checkup, you should get the liver function test checked every year at least, so that we know that liver function tests are stable. And also, certainly if you have fatty liver, there's risk of progression to forming scarring. So there are certain excellent scans which are available, what we call a fibroscan, which will also tell us the amount of fat that you have in the liver, and also the amount of scarring that is happening to the liver. So there are a lot more information that we can get these days. I would suggest getting liver function test and a scan, and possibly even a fibroscan every year, so that we can keep ourselves checked.
Okay. Doctor, there was this interesting question. Gayatri Srinath says, if a newborn has jaundice, does that mean that he cannot donate blood after he's grown up? Or
No,
hepatitis B? If a person has hepatitis B, both questions. If one had hepatitis B, can they donate? And if there's a child who's born with jaundice?
See, the childhood jaundice is very common. Newborn babies will have jaundice. There's something called physiological jaundice. So you probably must have seen people putting the kids in the sunlight so that we can remove the jaundice. That's a physiological jaundice. So they normally grow with normal functioning liver. They don't have any problem if it's a physiological jaundice. That is a normal process that happens. But some people can have pathological jaundice. In other words, there is a problem in the liver or in the bile flow, as we discussed, the biliary atresia problem. So those are the people we need to understand why the kids have got jaundice. Okay, so that's the first part of the question. So not necessarily that if they have jaundice in the childhood, they can't donate blood. Okay, so it's about understanding why they had jaundice. Okay, the second question is about hepatitis B. If you do have hepatitis B, it is your responsibility to make sure that you do not donate your blood to anybody else, because, as I said, hepatitis B gets transmitted through blood-to-blood contact. So and universally, all the blood banks, they actually check for hepatitis B. So even if you go and want to donate blood, they won't be able to take your blood, because they have a strict rules, universal rules about not giving infected blood to anybody else. So they will straight away reject your blood.
Okay. So last two questions that I would want to take. One is about H. pylori. Somebody's been asking, please throw light on H. pylori. And I'm not sure if we can take up without not much of information here, but he wants to know more about liver hemangioma.
Okay, right. So H. pylori, as I said, is a bacteria, Helicobacter pylori, which sits in the stomach and causes more acid generation. Okay, so when this acid generates more, you get these gastritis type symptoms. When that progresses, this gastritis can lead to gastric ulcers. And sometimes these gastric ulcers, if they are persistent for long enough, for a number of years, that can also lead to gastric cancers. Okay, so so H. pylori is what we say in the medical terms, a pre-malignant condition, or something which can lead to cancer in the long run. Okay, so it's important that we control the H. pylori, we eradicate the H. pylori. At the same time, we control the symptoms. Okay. Now, although I'm trying to scare you, saying that gastric cancer, it can lead to gastric cancer, but having said that, it only happens if the H. pylori stays in your stomach for a number of years. Okay. So as long as you remove the infection, the bacterial infection, as long as you don't have any symptoms and you don't ignore any symptoms. The reason I say that is, if somebody has acid symptoms lasting for more than a month, or if they are losing appetite, or if they lost weight, and they're having difficulty in swallowing, these are all the alarming symptoms. Okay, you should not ignore anything out of the box which are staying for more than 2 to 3 weeks or a month, you need to get yourself checked. Because if we correct these problems at an earlier stage, then we can prevent further serious problems. Wow. So that's the first question about H. pylori. Yeah. About liver hemangiomas. So hemangiomas is nothing but simple blood clots that we see in the liver. Okay, that's what we call medical terms as hemangioma. Generally, hemangiomas are harmless or not harmful conditions. It's nothing but just a small blobs of blood clots getting collected into the blood. But if the hemangiomas are growing in size, or if they're getting infected, or if they bleed, then problems can happen. And these problems, generally we see that in people who the size of the hemangioma is growing, or they have bigger hemangiomas, or his blood clot is sitting on the surface of the liver. So that those are the risks that we see. So I think we need to understand the size, the location of these hemangiomas to tell you about what we need to do about it, about these hemangiomas. But generally these are harmless conditions. They don't grow into a cancer, for example, but they can bleed, they can grow in size, they can get infected.
Okay, so Ravindra Babu Garu and Harish, I think your questions are answered. Many more questions, that similar questions which I didn't take up. I hope the answer reaches the right person, and that's the show's the USP of the show is that everybody should get their answer through somebody else's question. Thank you so much, Dr. Garu, for your patience and the energy and enthusiasm that you have to answer the questions. So as we conclude, can I get some top tips to take care of the liver?
Yeah, absolutely. And thank you, Jhansi Garu and the Apollo 24/7 team to giving me this opportunity to talk about liver, because I'm very passionate about liver, because liver is such a big organ. It's a big chemical factory, as I said, does a lot of functions, and it is important that we look after our liver. And in this regard, I would like to say a few tips about how to look after liver. I think the most important thing to look after the liver is having a healthy lifestyle. That is the most important thing. Having adequate, balanced diet is very important. Having adequate exercise every day, which is very crucial to our body and liver to recover and to stabilize. And also making sure that you understand if there is any problem, try to understand why there's a problem to the liver. So as I said, there are 150 different reasons why liver can get affected, including the common things like viral hepatitis, alcohol, fatty liver. So you need to understand, do I have risks for these things, and get yourself regularly checked. I would suggest to get liver function test every year, and also viral check regularly. And if you do have any of these problems, you can consult a doctor, because if we pick these problems at an earlier stages, then we can rectify them before it reaches the irreversible stage and to the liver cancer. So I think we need to look after ourselves, taking all the precautions about how to look after the liver, eating healthily, having balanced diet, getting yourself regularly checked, and don't hesitate to consult a doctor if you do find any problems. There are excellent treatments available for liver, including liver transplants, which people used to think it is a very scary operation, but absolutely not. Throughout the world, the number of transplants, lakhs and lakhs of transplants are happening with a very good successful outcome. That is because the surgical techniques have improved, the liver not to get rejected, the medications have improved quite significantly, the care has improved. I would say the liver transplant, which has been done only to people who can't recover without having transplant, we only suggest liver transplant to those patients, but they will have an excellent life after the transplant. Not only the longevity or the number of years they're going to live, we're talking about 20, 30 years, or even 40 years life expectancy after liver transplant. But not only that, we're looking at the good quality life. A lot of people go back to their own usual self, usual work, jobs, family life, reproductive life, everything after liver transplant as well. So don't hesitate to take help if you have any problems with your liver. There are excellent treatments available, and please do stay safe and look after your liver and yourself.
Yes, doctor. Taking away that one needs to eat well, exercise well, and eat moderately.
Absolutely.
Thank you so much. So congratulations again, and let's all spread awareness about liver health. Let's all celebrate World Liver Day in a positive light. Thank you, doctor. Thank you so much. Namaste. Well, that was a lovely session with Dr. Naveen Polavarapu. We thank him for his energy and enthusiasm. And I continue with health quiz. Here are 3 questions that you can answer in the chat box. I'm going to ask you 3 questions. The winner's name will be announced towards the end of the webinar. Winners, once you're declared a winner, you have to mail your contact details at marketing@apollo247.com. Gift vouchers will be shared with you. So get ready. Today's health quiz. First question. What percentage of liver consists of water? What percentage of liver consists of water? Answer kijiye. Please type your question number and the answer. Please, if you're answering multiple questions, please do type the question number. The question number 1 is, what percentage of liver consists of water? Question number 2 coming up. What is the approximate weight of human liver? What is the approximate weight of human liver? Question number 2. Baswaraj Patil ji, 79%. Do you think that 79% of liver is water? आप Google कीजिए और आंसर टाइप कीजिए. What is the approximate weight of human liver? This is question number 2. And question number 3 coming up. Which feature in Apollo 247 app allows you to book blood and urine tests? Which feature in Apollo 247 app allows you to book blood and urine tests? अगर आपको blood test और urine test करवानी है Apollo 247 app में, which feature do you have to use? Simple question. If you have Apollo 247, you can check what is the tab that is called. If you don't have the app, please download the app and see what the answer is. 2 kg, Nibu Augustine 2 kgs, Rohit Vardhan 1.72, 80, Nibu Augustine 2 kgs, 1 kg. Ek answer lenge, please. All right, so let's see who the winners are in a while. But before that, let me show you an AV of how you can benefit from Apollo 247, the entire Apollo hospital in one app, and how can you make use of it. Here's a small AV.
एक टैब में डॉक्टर, समय नौरा फैक्टर, सुबह से रात तक बुला लो बेझिझक, दवाई चाहिए ए सब तो बस एक टैब, हाँ बस एक टैब. दवाई 2 घंटे में डॉक्टर्स भी मिलेंगे, सिर्फ 15 मिनट में बस एक टैब, हाँ बस एक टैब. हैदराबाद टू बैंगलोर, दिल्ली चेन्नई डोर टू डोर,
अपोलो की एक्सपर्टीज पाने के लिए डाउनलोड द अपोलो 24/7 ऐप. अपोलो 24/7 एक्सपर्टीज इज फॉर एवरीवन.
So Apollo 24/7, you can consult a doctor in 15 minutes. You can get your medicines delivered in 2 hours. And if you're a Circle member, and there are a lot of secret savings also. So please download the app. Now for the winners. The winners of today's quiz session are Venkata Madugula, Prithvi B, and Sean David. Congratulations. Please mail to us. Write your contact details to Apollo marketing@apollo247.com, and please claim your gifts. Thank you so much, all of you. It was a wonderful session. Please take care of your health, especially liver. And as a small token of gratitude, here are the gift coupons that you can use. Use coupon Apollo247 to get up to $299 off on online doctor consultation with Apollo doctors. Use coupon Medicine10 to get 10% off on pharmacy orders. You can use these coupons on Apollo 247. Log on to Apollo 247 app, download it, and get the benefits out of it. So thank you so much, all of you. It was a wonderful session. Thanks for joining us. Please do share your feedback at marketing@apollo247.com. Thank you once again.